Now we can talk to Gavin Yami, Professor of Global Health and Public Policy at Duke University in the US. Hello, thank you very much indeed for your time. Now, we've just been hearing from Donald Trump, the US president, saying that progress is being made on the response to the coronavirus pandemic. What do you make of the response so far?
Well, obviously, I'm very pleased to see some steps in the right direction. This has been incredibly recent. That announcement was only yesterday. Over the last few weeks, it has been astonishingly frustrating, and we've really lost a lot of time. Right now, the number of new cases of COVID-19 is doubling every 3 to 4 days. And that puts us on a trajectory very similar to the one in Italy. Italy, of course, has had a huge number of cases. The health system is overburdened, and doctors are making very agonizing decisions about who they can keep alive and who they can't because they've run out of ventilators. We are currently on that same trajectory, and I fear we left things so late to actually start taking action.
Is
We
it too
have been
late?
asleep at the wheel for all sorts of reasons. Well, we have to do 5 things right now, urgently and aggressively. You'll know that a couple of days ago, Donald Trump announced a national day of prayer. We were tearing out our hair saying prayer isn't what we need. We need to massively scale up testing. We have still got far few tests. The CDC here bungled the initial rollout of the test. The US refused WHO, the World Health Organization's offer of tests, and so we're still shooting in the dark when it comes to testing. We need to absolutely aggressively use social distancing. Right now, I heard your report from California. Some states are applying social distancing measures, but others aren't. We have this kind of patchwork that leaves areas of the country vulnerable. We have, number 3, health workers who don't have personal protective equipment. 2, emergency physicians are in critical condition. What kind of country are we where we can't protect our frontline workers? We need far better communication, number 4, and coordination between the federal government and the states. It's still not clear who's doing what. And finally, we need to accept and acknowledge that there are going to be more cases. We need hospitals and clinics ready and prepared. And just a couple of days ago, it was incredibly disheartening to hear Donald Trump tell the governors nationwide that essentially they need to just buy their own equipment, their own ventilators, their own respirators. No, this is the time for the federal government to get serious. With these 5 key measures, the kinds of measures that were adopted in countries like South Korea and Singapore, we could avert an Italian-style catastrophe.
Like you say, that the US has a federal system, but you're insisting on the fact that it's really up to Washington to issue guidelines, perhaps even impose certain measures.
I think many public health experts and many global health experts would say we are never going to be criticized for doing too much right now. Anthony Fauci, who is the director of the National Institutes of Allergy and Infectious Diseases, who has become one of the most vocal experts on this topic, has said, be aggressive now. So I think the voluntary measures that Donald Trump mentioned yesterday, that people shouldn't gather in groups of 10 or more, the voluntary ideas that people shouldn't go out to restaurants and bars, the voluntary notion that some schools might close and some not, this should end. I believe that we need mandatory steps, mandatory measures, mandatory activities, so that people are socially distanced, at least 2 meters away from each other. And we've
And
got to get serious about testing. We seem to have just kind of given up on testing, and it's like a surgeon operating with the lights off. If we can't test people, we can't make sure that those with the disease get the right treatment. We can't do tracing of those who've been in contact with the disease. We can't protect our health workers, and we can't really know where the hotspots are.
now, you touched on this. I wanted to ask you about how long this could potentially go on for. Donald Trump said it could last until the end of the summer. I mean, is that a conservative estimate? Or I suppose it depends, like you said, on how much we get done and when.
I think that's right. I mean, there was a study that came out yesterday from a research group at Imperial College London. It's a study that looked at the UK and the United States, different scenarios that were modeled as to what might happen if certain steps and measures were taken versus if they were not. I'm pretty sure that both the US and the UK governments saw that study and realized that the measures that they have been using have been way too lax. The measures that have been used to date in the US and the UK have really been about what's called mitigation, just trying to slow the epidemic. In fact, what they really need to do is to try and suppress the epidemic. That's what the government has done in places like Hong Kong, Singapore, South Korea. And there you have seen that they have managed to get the outbreak under control. What isn't clear is what would happen if we take in those countries if we take our foot off the gas and relax those measures. We may have to keep those measures in place for a much longer time. Efforts are underway right now to develop a vaccine. The first human trial began yesterday in Seattle that is funded by the NIAID here in the US. A vaccine is probably 12 to 18 months away. Certainly, with a pandemic situation, it is absolutely critical that we develop a vaccine.
Okay.
And it just may be that control measures of some shape or form are going to be needed for that long.
All right, we really appreciate your time and your analysis. Thank you very much indeed, Gavin Yamey from Duke University. Now, UEFA, European football's governing body, has been discussing football's response to the coronavirus crisis, and it's decided to postpone the Euro 2020 championship that was due to take place in June and July. The Copa America that was due to be held in Colombia and Argentina has also been postponed to next year. Our sports editor Simon Harding has more.
No Euros this year, and it was a decision, if truth be told, was expected by the footballing community and by the